everyone. Welcome to the first ever YO.DH podcast. I am Saloni. I'm a digital health entrepreneur, a member of the youth community, and your host. At the outset, let me tell you all a little about YO.DH. So, YO.DH is a vibrant community focused on empowering young digital health professionals under 35. The platform aims to enhance inclusivity and strength in digital health initiatives while equipping the next generation of leaders with crucial skills, network, and mentorship. Our guest today, Mr. Rathish Balakrishnan, is founding partner at Sattva Consulting. Rathish leverages 20 plus years of experience in merging sectors for large scale solutions. His commitment to eradicating poverty has fueled his work in education, healthcare, and empowering marginalized groups. He's a published author, a TEDx speaker, dedicated to tackling systemic societal complexities. Hello, and a very warm welcome to you, Rathish. Thank you for joining us today.
Thank you for having me.
It's totally a pleasure. Seems as the tables have turned today. For those of you who don't know, Ratish is an enthusiastic podcaster himself, and it's so delightful to have you be on the other side and hear your views uncovering digital health with us today.
Yeah, it's a lot easier to ask questions and give answers. So I'm hoping that this is going to be easier for me. Yeah, go ahead.
Yes, we certainly looking forward to just an engaging discussion. Well, amidst the dynamic shifts in global health triggered by the COVID-19 pandemic, digital health has risen in prominence. The challenges posed to the countries have propelled digital health technologies into critical roles, facilitating remote healthcare services, telemedicine, contact tracing, remote monitoring, and widespread health information dissemination. This rapid adoption and integration of digital health solutions has underscored their pivotal significance in maintaining healthcare continuity during these transformative times. So, on that note, Ratish, addressing the first half of digital health first, do you think that digital is a synonym to technology or does it go above and beyond?
I think that's a great question because I've realized across multiple sectors that I work in, words matter a lot, right? And when you call something digital, and I had the same conversation today with somebody on livelihoods as well. So when you say digital, people immediately link it to digital literacy, etc. But when you say technology, I think the ambit becomes much broader, right? And so when you talk about digital, oftentimes the articulation is a lot more around software-led solutions that are used in the technology in the health space. But when you apply the word technology to it, I think it becomes a much broader ambit. We are looking at wearables, for example. We are looking at low-cost devices that can be created that can provide accurate outcomes. We are looking at other forms of physical tactile solutions that are technology led and can enable last mile workforce beyond just digital solutions, which really for me combines software and data and interactivity that can enable health outcomes in various forms. So I do think it is extremely critical to separate the two and ensure that when we talk about digital, we are taking a more health tech focus rather than just a digital health focus overall.
Very true. Working in femtech myself, I mean, we see the sector expanding all the time, right? And wearables and all of that is such a crucial aspect of things. So certainly a much more wider ambit and a better approach to take in that sense. It's often believed that the true meaning and tangible sustainability lies in viewing digital less as a thing and more as a way of doing things. So less of a thing in itself and more of a way of life. With that in mind, would it be right to call digital the new driver for sustainability in the health sector?
I mean, it's a loaded question, right? Maybe let me ask you this: how do you define sustainability?
So sustainability in terms of just long-term solutions that bring about tangible benefits in that sense, that have widespread reach across demographics, like in that sense.
Yeah. And that's an important aspect that you've added there, right? I think there is a way people understand sustainability, which is very different across different people. Typically, what happens in a
Hmm.
lot of health work is that while an intervention is financed and supported, it sort of creates a lot of value. And once you remove the funding and the initiative stops, the health outcomes revert back to the earlier equilibrium, right? So in some sense, there are these spikes that happen, and then we sort of limit it, come back to the earlier equilibrium. The equilibrium is not shifted. So sustainability for me is when the equilibrium shifts, which is in an irreversible way, we have been able to move an outcome from X to Y, right? And we have been able to do that in health across many areas. You know, our maternal mortality rates, infant mortality rates have actually improved significantly in an irreversible way. It's not like we are sort of seeing spikes in it, right? And the pace can be faster, but it is irreversible. So the question really is technology creating irreversible change in the health system? And there, I do feel that it is not a silver bullet. We should not say that digital is going to create sustainable change. I think digitally enabled public system or public health approaches can help us drive sustainability much more. Happy to explain why. But the articulation that it's digitally enabled and not digital is, I think, a very, very important difference.
Yes, certainly. Because I mean, solving those issues is far more of a widespread problem than just, creating an enabler in that sense, making tangible change is something that's only going to come when we look beyond projections of moving through those spikes, I guess, just as you very well explained. Coming back to digital health and its role in ensuring continuum of care. As digital health becomes a sector in itself, how about sustainability within the digital health ecosystem?
Yeah, I think again there are the way you describe sustainability here might be different from how you describe sustainability there. So let me talk about two things, and then I come back to the sustainability question. Firstly, I think the continuum of care point I think is very, very important, right? Today, for whatever reason, health is understood as layers on top of which individual people are working, which is primary care, secondary, tertiary, etc. Then there is prevention, but I think the idea that there's a person at the center of this entire experience is actually very, very difficult for people to achieve, right? Because the kind of capabilities, the kind of responsibilities, and the kind of services and value that we have to deliver to an individual is actually different at each of these levels. One of the biggest value for me that technology and digital actually have as a role to play is being able to put the person at the center and giving that end-to-end view, which is what we call continuum of care, which is that like a
Country.
company is conducting a camp for the screening for
Yeah.
cervical cancer, but the same person in the health
Mhm.
record is able to say, okay, you've been diagnosed for possible risk. They are able to go to the required health center. The person at the health center has that access. And then there is a, if required, a tertiary access that is required as well. And so building that connectivity by keeping the person at the center, I think is going to be very, very critical. So I just wanted to take that point on the continuum of care because I think it's a very important point that you raised.
Yeah.
Now let's come back to sustainability and let me come back to how do we enable sustainability in the digital ecosystem and tie it back to why I call digital enablement. I think if you give me today a rocket launcher, I will have no idea what to do, right? Because I don't know how to launch a rocket. I don't know what I can do with a rocket. And once a rocket is launched, by God's will, I don't know how to make it better, right? And that is a very similar problem that we might have with digital again, right? The challenge for us, for digital to be truly sustainable,
Yes.
we need to embed digital in the work context of the person who's going to use digital, number one. Number two, we should enable the skills to make meaning out of the data that comes out of digital within the system. Three, we should have established feedback loops to make sure that the digital interventions are effective within the system at multiple levels. And four, some of the non-linear population scale value that digital can unlock, we should both have the imagination and the ability to unlock. If this doesn't happen, what's going to happen is that some public official is going to get excited about digital, they're going to deploy it and they're going to realize nothing changed and they're going to throw it and move to the next thing, right? So to make digital sustainable, taking a systems view of this is very important.
Very true. I mean, you got to think big. And sustainability and expansion of digital tools, like for community health at large, is something that can change just by how we build those tools, how we deploy them, and how we scale them, like you rightly said, right? So I guess those are certainly three very important aspects that we would be looking at in that sense. The healthcare sector is seeing a lot of investment and commitment to building infrastructure, just as we are discussing. However, this would all be in vain if it isn't accessed and utilized the way it possibly should be, like we were just discussing. What kind of impact do you think digital health has brought in improving healthcare access in that sense?
Uh, you know, Nachiket Moore and I had this very, very interesting conversation on what is the way you can design public health systems overall, and what are lessons we are learning from the worldwide approach, right? And one of the things that stands out, and even in the most effective models, is to move away from a model that is centered around a doctor, right? In any country which is as populated as ours and as diverse as ours, I think it's fair to say that the people who need the doctor the most are often the people who will not have access to a competent doctor. It's the paradox that is going to be very hard to solve. So the only way you can deliver better healthcare is by enabling people who are not doctors to be able to address the 80% scenario as
Mm-hmm.
much as possible. Now, human capital across the country is actually of very varied quality, right? Great teachers are hard to
Right.
find, great nurses are hard to find, great A&Ms are going to be hard to find. I mean, it's just a fact of nature, right? It's just that it's human capital problem. For me, the magic of technology is that it can take a well-intentioned, culturally embedded, committed A&M or health worker and make them an effective health worker, because it's easier to find a committed, culturally embedded, competent health worker who may not have the health expertise. But what digital health does is to combine all of those strengths that they have and give them tools that make it repeatable and effective to deliver on health interventions on the ground, right? So, how does access to healthcare become easier because of digital? Is because this tech plus touch model of combining effective technology with a
Hmm.
culturally embedded, committed person on the ground can actually help us deliver high quality healthcare.
I think the tech plus touch model that you spoke about is something that would be very interesting for our audience to dive in, our younger audience especially. If you could further elaborate a little more on that and how you think that that could, say, perhaps ensure equitable access in healthcare in a country like ours, wherein touch points are essentially so important to bring about actual tangible ground on the ground change through digital health
Yeah,
initiatives.
uh,
So more on that from you, please.
absolutely. So I want to give credit to the Arman team, which is a leading nonprofit, and Aparna Hegde and their team for this articulation of Tech Plus Touch. I really borrowed it from them, and I found it always very helpful. If you look at health as a problem, health is a very context specific problem, which means where you live, your lifestyle, your cultural norms, your traditional practices has impact on your health. Number one. Number two, health is as much a trust based relationship as much as it is a competence based relationship. There is zero correlation between a competent doctor getting a lot of patients, right? But there is a lot of correlation between a doctor or any healer who the community trusts getting a lot more patients, because trust plays a huge role in what people will do or not do.
Very true.
Three, health seeking behavior is not a technical problem alone. There has to be this human nudge in getting people to access healthcare or just apply, perform health seeking behavior for them to be healthy, which technology often will find it hard to solve. I mean, it has a role, but it finds it hard to solve. All of these mean that a pure play technology solution where you're just deploying something on the ground will not work, because A, it is not contextual, B, it does not bring in the trust equation, and C, it doesn't change the health seeking behavior, because only when somebody comes to you is when the technology can play a role. And I feel that these are areas where a person or a touch component becomes extremely critical, right? We during COVID we ran a survey as part of Satwa where we asked people who do they trust the most to accept a vaccine, and the answer was an ASHA worker, right? And no amount of SMS, no amount of videos, etc., is going to solve that problem. And so for me, understanding this context and then being able to bring the right and the most effective technology, bringing it together is really the key for us to solve social and health issues. And that is why I strongly believe that tech plus touch approach is very, very
Very, very true. I mean, contextualizing everything is it's very, very important. And creating that health ecosystem, I think that was also a very interesting point that you touched upon, right? The fact that we need to strengthen the ecosystem and not just have it, centered around doctors in that sense, to provide that kind of effective, touch approach in that sense is also certainly very important. Trust, of course, is something that, I mean, healthcare and just doctors in general, it's something that's seen as a noble profession, and it's only when that kind of relationship is established when people go ahead and feel that trust. So certainly strengthening the whole system in that sense would of course be a great approach. Moving on, what's your favorite example of how digital health is accelerating health outcomes in underserved areas?
Actually, there are a ton of examples, but I can tell you more than my favorite example, what I think is most critical, and this is an area that Sattva is very, very strongly committed to, is really to look at the intersection of digital health with women health outcomes. I believe that there is a significant amount of effort that has to be done in that space for us to work on it, because by definition women's health becomes an intergenerational problem. you know a healthy
Very
adolescent
true.
becomes a healthy mother means a healthy child means a healthy mother, and it sort of is an intergenerational issue. And number two, there are so many social determinants that impact the health seeking behavior and the health behavior of women overall. And there are cultural issues on what you can talk about, how you can talk about it, etc. And I do believe that if you really take that contextual factors that matter and look at the intergenerational impact that women's health has and combine that with some of the benefits of
Yeah.
digital health, I think there is going to be a significant
Yeah.
outcome that we can achieve. And for me, of all the things that we talk about, I think focusing on that as a critical priority, I think will be very, very
That really feels like a personal push, quite frankly. Working in this space, I understand that, equitable access of healthcare for women essentially is so deeply rooted in all the contextual problems and how hard it is for women to access healthcare. And of course, what you spoke about, the intergenerational curse of being deprived of, right, the right kind of healthcare access is something that can solve just the solutions are so wide reaching that it certainly solves a whole bunch of problems in society at large. So love your inputs there. Do you think India has been able to make digital health an integral part of the healthcare value chain? What if you were to draw a comparison with the West or the developed world in that sense?
Yeah, let's separate the two questions. So honestly, it is a bit of an apples and oranges to look at
Sure.
developed world and us. I mean,
True.
we need digital health way more than they do, in my opinion. And I don't
Very
think
true.
that,
After contextualizing
yeah,
everything.
and I mean, their health systems are different. Their purchasing power is different. Their health access is different. The population size is different.
Yeah,
So I wouldn't even worry about what the developed
totally.
world does, to be honest. It's probably an inconsequential comparison. But have we made digital health an integral part of our public health systems? The answer is no. I mean, we still don't know how to really procure and contract digital health devices at scale in the public health system, number one. We don't have the right last mile infrastructure and the change management ability for our health
Yeah.
workers to be able to effectively use digital yet. The issues of imagination of how public digital health can be looked at in an integral manner is still missing in the public health systems in India. So I think there is an imagination gap, there's a contracting gap, there's a project management gap, there's a last mile change
Mm.
management gap. I think all of this is significant, which is more on the demand side, which is really from a systems perspective to look at it.
Yeah.
From the supply side perspective, the value of depth in digital
Yeah.
health is a very real problem. There's a significant amount of capital that's going into
Mm.
the R&D of digital health technology. So lots of lab
Yeah.
solutions in BIRAC and CCAMP, etc., do phenomenal work. Then there is a lot of venture
Mm.
capital investments that
Yeah.
are growing in health tech investments, especially wearables,
Oh, yes.
fitness, etc., targeting the India A population. But the value of depth in between, for especially technologies in diagnostics, screening, which require strong regulation, effective population scale validation, we still haven't solved the problem. We still don't have the systems to finance those and to validate those at scale so that we can accelerate a lot of them to move to market adoption, public systems adoption yet. So, both on the supply side and the demand side, I think there are systemic challenges that we have to solve for. It's not all doom. I think there are lots of promising technologies. COVID, as you said, was a good motivation for people to adopt it. ABDM is bringing in a certain infrastructure that can shift the equilibrium, all of which is great. But I think it's fair to say that we have a long way to go.
Very true. I think there's like a lot of untapped potential there, and I think again to bring the whole tech plus touch model to the center of this approach, I think it'll solve a whole bunch of problems on the demand and the supply side in that sense. If there's a more holistic approach taken towards that, according to you, what would be the top three unresolved challenges to fully digitize the healthcare value chain?
Let me give it a shot. The first one is really to streamline the supply side gap and address the value of that. I think we need a lot more population scale validated, ground validated solutions that we need in the market across, especially screening and diagnostics, areas, which really will speak to the needs of rural and hinterland India today. I think there is a gap that we have to address. The greater the supply there, I think the demand system start to change. I think that's number one. I think the second is building the state capacity to imagine, contract, and deploy health solutions within the government. I think is going to be very, very critical because public health systems today are not ready. While we are solving for sometimes the last mile gap, I think we need to take a full system approach and look at what does a full state capacity for delivering on digital health look like. I think that's the second critical priority that we need. I think the third thing that we need, which is really a use case based approach for demonstrating technology value. I think a lot of the dialogue today is, oh, I have this technology, what do I do? I think we should take a disease based, value based approach and saying, okay, this particular problem has to be solved. How do I combine tech, touch, system and make that happen? And the more we demonstrate this value per use case and outcomes, I feel like the imagination to then see how what can be done for others becomes easier. So I think there's the supply side gap, there is a state capacity gap, and then there is a demand side gap from a use case point of view. I think solving for all three, I think, is going to be very, very.
Just speaking to you right now, it just struck me that, very recently I read in a report also. I mean, it kind of validated what you said in the first half of like your three, challenges, talking about how, the diagnostic sector and the screening sector is, say, undervalidated in that sense. And, it's just highly untapped. What do you think are the challenges there, and why do you think it is so? Because I guess, like, there's like a lot of tangible on ground change that those can create in that sense, like how you said also. So, why do you think the situation is the way it is in that scope?
Yeah, see, I think the two parts to that question. One part of the question, and again, I'm coming back to the value of debt. Let's say you are an entrepreneur who has built this very accurate diagnostic device. You've tested it in your lab, you've tested it with, let's say, 10 people. It seems to work. And there you want to then go to a public context, right? Any community or, let's say, a market and say, hey, listen, I use my diagnostic device for accurate measurement. Who takes the risk here? Right? You as an entrepreneur will say, listen, I can only test it after it's deployed on the ground. So let's test it. And the person who's on the other side, which is a public health practitioner or a private health practitioner, is essentially saying, if it's not proven, I can't deploy it because then I carry the liability of this. And there is today a systemic gap in making that happen at scale. I mean, there are solutions that sort of go through this curve,
Hmm.
but I don't think the rails for
Hmm.
enabling this is actually effective and done for a wide range of solutions, right? And I think that is a significant gap on the supply side. There are discussions, and
Yeah.
we've spoken about this to multiple organizations to create fairly large scale sandboxes that allow for community validation to happen at scale, that provide us the validation and ensures that it covers for the risk that a new technology brings in. And in the absence of this, I think healthcare entrepreneurs typically look at other countries, other places where such systems are actually working, right? I think that's number one. Number two, I think selling to businesses and doing public procurement are still very, very hard problems to solve for entrepreneurs. For individual entrepreneurs to crack the public procurement system for screening and diagnostics, there is no incentive alignment for anyone to use something that's new, right? And I think solving for that incentive in the government system to procure and use new technologies to deliver better outcomes have to be sorted for. And I don't think that we have done that yet. And lastly, I think that we don't have the imagination of how our frontline workers can actually be more effective today. I think it's a very, very people intensive, process based approach where the system is designed for them to be subpar, right? Now, unless you reimagine the frontline experience of healthcare in India, you will not create the demand for effective diagnostic and screening solutions. And I think that's a problem, right? I feel it's a combination of these.
I think that's why we should adopt from the West and possibly contextualize and understand how, it's high time that we perhaps reimagine in order to utilize all the innovation that the country is bringing in. Otherwise, we're just largely seeing solutions that are being created for the West within our country. Whereas, if say the system was designed more so wherein adoption was slightly easier, perhaps we would see far more wide-reaching
Yeah.
change within our country as well. Well, I completely agree with you there. And on that note, youth is all about empowering young professionals as future leaders. So, lastly, what would be your final input on the perks of strengthening youth ownership of digital health?
See, I think I mean, I say this on a lighter vein. The good thing about being young people is that you're more obstinate than everybody else because you still have this, unbridled, irrational enthusiasm that something can be made to work when others don't. And as somebody who's been young a long time ago, I can tell you that's a gift, right? Because you sort of have jaded eyes when you have been in the system for a while. And I think we need fresh imagination in the way we can solve some of these health issues. And I think, hence, yeah, ownership of young people to solve these health problems and being native to the digital experience that people are used to today, I think is actually very, very critical. And so I do believe that we need a lot more young people, a lot more experimentation, etc. The only suggestion, that I would give to young people is how can you learn faster? Because a lot of times, young people also come with this view that, which is like a flip side of their irrational enthusiasm, that they are like the first person on the moon. So they sort of deceive everything has to be done again. To your earlier point, I think there's some great examples of how we can learn from countries like Thailand. Even countries like Iran have some great examples on how public health systems are running. So I think one being able to learn faster from the work that's not just been done in India but globally, and finding a way to be able to create those solutions, I think is going to be.